How long have you been treating patients with severe skin diseases?
I've been treating patients with severe skin diseases since 1977, over 30 years. Severe diseases, not only atopic dermatitis, but psoriasis and many other skin diseases. I've been treating Japanese patients with atopic dermatitis for over 15 years. And they have been anywhere from moderate to very severe, many of whom have spent long times in hospitals in Japan.
So what are the common treatments for atopic dermatitis?
Well, the first step is obtaining a thorough history of the patient's atopic dermatitis. We want to know the age of onset of the condition, where on the skin it began, how severe it was, how it was treated, how it responded to treatment. We want to know the clinical course of the disease over the years, depending upon how old the patient is. We want to know if there's also accompanying asthma or hay fever. We also want to know what the family history is. We also want to know what the environment that the patient lives in. We want to examine the patient, look at the skin, and determine the severity, the distribution, one of many different patterns that it can be. We need to check for the presence of infection, viral, bacterial. We need to examine the barrier effectiveness of the skin and look for clues for trigger factors. One of these is scratch testing, which can help identify allergies that we may be able to help with immunotherapy. Other clues help us with other trigger factors. Also, we examine for the presence of viral or bacterial infection, which can have a significant effect on the course. Many atopic patients have problems with herpes simplex infections, and if an atopic patient has a herpes flare, then it can spread to the atopic skin and they can become extremely ill. Even minor herpes outbreaks can flare the atopic dermatitis, so it's very important to treat the outbreaks and then to try and prevent other outbreaks, and this is done with proper medications, and very effective and safe medications are available for this. The use of topical steroidal ointments and creams and non-steroidal ointments and creams is a mainstay, very important in the treatment of atopic dermatitis, but it's critically important that the correct and appropriate topical medications be used in accordance with safe instructions. They can be used safely, they are very useful tools, but they need to be used appropriately. The use of internal steroidal medications is also very valuable in controlling flares and outbreaks, because these will happen. And internal steroid medications can be used very effectively and very safely if they're used properly. And they're very important in our treatment. And I might say that in the 30 years that I have been in practice, treating hundreds of patients with atopic dermatitis, I've never had to hospitalize a patient with atopic dermatitis.
So why do we see a lot less people with atopic dermatitis in the U.S.? Because a lot of the patients in Japan will witness more atopic dermatitis people in Japan, maybe about 2 to 3 people on average in a busy train ride in their daily commute.
I think one sees a larger number of more visible patients in Japan for 2 reasons. The first is that studies have shown that atopic dermatitis, particularly more severe atopic dermatitis in adults, is seen more often in urban centers, more densely populated areas compared to rural areas or less populated. The second reason is that atopic dermatitis is treated differently in the U.S. It's treated at an earlier age. Dermatologists are trained in the treatment of it at an early age, and also in the appropriate use of medications to control it. And so it is not common to see severe atopic dermatitis, particularly in adults, in such an uncontrolled fashion as you do in Japan.
So what can a child and their families do to prevent severe atopic flares while they're growing up? And also, are there any other treatment to use other than a strong topical steroids, and any prevention for infection for these children?
Well, the most important thing is the early beginning of a skincare treatment program that is appropriate, that they've been instructed on to try and maintain the barrier integrity of these children when they're young. There is evidence that this barrier, when it is not there, inadequate in these atopic children, allows the entrance of particles such as microbes, bacteria, viruses that can actually have permanent effects on the immune systems of these children. Also, if the barrier is not there, then the allergy particles can penetrate the skin and again alter immune function and influence the course of the disease later in life. Recognition and prevention of infections is extremely important, and when there is infection present, it needs to be treated promptly and appropriately. Preventing infections is important, and such things as bleach baths and, if need be, treatment of household members with antibiotics when necessary, again to prevent recurrent infection. The environmental factors such as trying to control molds, dust mites, potential allergic particles from being in the air of the home are important, and then paying attention and recognizing trigger factors. When there are flare-ups, then they need to be treated just like adults. They need to make sure that they have recognized infection and treated that, which is very common in these children because they play with each other and are infecting each other all the time, as well as occasionally treating them with oral cortisone products to get control of the flare quickly and get them under control.
So what are the dangers of steroid use, and how can it be used safely?
Inappropriate use of topical corticosteroids can lead to a number of significant side effects. They include thinning of the skin, permanent stretching, suppression of the adrenal gland, and of course, as many Japanese atopic patients are familiar with, rebound when they're discontinued. The important thing in use of topical corticosteroids is the appropriate selection of the medication to match the location on the skin, the appropriate duration of treatment, such that these side effects are not encountered. And it's possible to do this without running into these side effects. Able to do that quite successfully in our patients. Our patients do not have trouble with rebound because they're using the appropriate topical steroid in the appropriate location for the appropriate amount of time. Internal cortisone products can lead to a long list of serious medical and health problems. The consequence of these can range anywhere from cataracts to high blood pressure to many serious problems. We never use internal cortisone, either in doses or even more importantly, uninterrupted duration to get into problems with these side effects. And all the time that I have been treating atopic patients, or for that matter, patients with other severe skin diseases, have not had people get into problems because of our courses of internal cortisone. We are very strict with dosage and timing. Internal cortisones are not for maintenance. They are to rescue, they are to get back under control so that we can then return to maintenance with safe products.
So any other comments you would like to add?
Well, in general, when patients come over here, we see them at the beginning and they're typically in pretty rough shape, and we try and quiet them down as quickly as possible, get them comfortable, cool off the skin, treat the infections, start instituting proper skin care, and start the education process. The important thing is that while they're here, they only have one job, and that's to get better. And often, most of the time, I should say, they're here for a month, and that's enough. Some patients are more severe, particularly those who have been using strong topical steroids and have to be managed through a rebound, which we are experienced in doing and can do comfortably with patients. And they may take a longer time before the skin is quiet enough that we can send them home comfortably. Every patient is unique, and every patient has a unique set of trigger factors. And while they're here, they will be scratch tested to identify other allergies. We will speak repeatedly and try and obtain proper histories to identify other trigger factors. We will delve into their home environment, and even while they're still here, they may start correcting things at home to try and successfully avoid these trigger factors. Again, every patient is unique, and by and large, we're able to help just about everyone. It's very important that when patients leave here, they understand that we have just started a process. Education, proper tools. Ultimately, all patients manage their own disease with our help. And when they go home, there will be ups and downs. We continue to manage them, we stay in contact, we treat, and over time, most of them notice a progressive improvement and stabilization of the skin. Hopefully to the point where when we don't hear from them, it's because they're doing so well.
I see. Well, thank you very much for your time.
Pleasure. Thank you.